Hello, my name is Intan Sari. I will explain to you of COVID-19. Coronavirus or severe acute respiratory syndrome coronavirus 2 is SARS-CoV-2 is a virus that attacks the respiratory system. This disease caused by a viral infection is called COVID-19. Coronavirus can cause disorder of the respiratory system, acute pneumonia until death. This virus infection is called COVID-19 and was first discovered in the city of Wuhan, China. This virus spread quickly and has spread to other regions in China and to several countries, including Indonesia. This has made several countries abroad implement policies to impose lockdown in order to prevent the spread of the coronavirus. Symptom of coronavirus. The initial symptom of coronavirus infection or COVID-19 can be such as fever, runny nose, dry cough, sore throat, and headache. After that, symptoms can worsen. Patient can experience high fever, cough with plague, and even blood, shortness of breath, and chest pain. These symptoms appear when the body reacts against the coronavirus. However, in general, there are three general symptoms that can indicate someone is infected with the coronavirus, namely fever, body temperature above 38 degrees Celsius, choke, hard to breathe. According to research, symptoms of COVID-19 appear within 2 days to 2 weeks after exposure to the coronavirus. When to see a doctor? Immediately to the independent isolation if you experience symptoms of coronavirus infection, COVID-19 as mentioned above, especially if symptoms appear 2 weeks after contact with sufferer of COVID-19 or are in an area that has a COVID-19 case. After that, contact the COVID-19 hotline at 119X 9 for further guidance. If you might be exposed to the coronavirus but don't experience any symptom, you don't need to see a hospital. Just stay at home for 40 days and limit contact with others. Cause of coronavirus. Coronavirus infection or COVID-19 is caused by coronavirus, which is a group of viruses that infect the respiratory system. In most cases, in coronavirus only cause mild to moderate respiratory infection, such as flu. However, this virus can also cause severe respiratory infection, such as pneumonia, Middle East Respiratory Syndrome, MARS, and severe acute respiratory syndrome, SARS. It is suspected that the coronavirus was initially transmitted from animals to humans. However, it was later discovered that the coronavirus was also transmitted from human to human. A person can get COVID-19 through a variety of ways, namely accidentally inhaling saliva splash drops that come out when people with COVID-19 cough or sneeze, hold mouth or nose without washing hands first after touching an object affected by saliva splash of a COVID-19 sufferer. Close contact with people with COVID-19, such as touching or shaking hands. Coronavirus can infect anyone, but the effect will be more dangerous or even fatal if it occurs in elderly people, pregnant women, people who have certain diseases, smokers, or people whose immune system are weak. Coronavirus diagnosis to determine whether the patient is infected with the coronavirus. The doctor will ask about the symptoms experienced by the patient. The doctor will also ask if the patient is traveling or living in an area that has a case of coronavirus infection before symptoms appear. To confirm the diagnosis of COVID-19, the doctor will carry out the following follow-up examination: rapid test as a filter, a throat swab test to examine Sputum samples, PCR tests, chest radiograph to detect infiltrates or fluid in the lungs. Coronavirus treatment. Coronavirus infection or COVID-19 cannot be treated, but there are some steps the doctor can take to reduce symptoms and prevent the spread of the virus, namely refer COVID-19 sufferer to undergo treatment and quarantine at the designated hospital, provide fever and pain reliefs that are safe and accordance with the patient condition, encourage sufferers of COVID-19 to do independent isolation, and educate rest, encourage sufferers of COVID-19 to drink lots of water to manage body fluid levels. Complication of coronavirus in severe case. Coronavirus infection can cause the following serious complications: pneumonia, lungs infection, secondary infection of other organs, kidney failure, acute cardiac injury, acute respiratory distress syndrome, death. Coronavirus prevention. Until now, there is no vaccine to prevent coronavirus infection or COVID-19. Therefore, the best prevention method is to avoid the factor that can cause you to be infected with the virus, namely physical distancing, which is to maintain a minimum distance of 1 meter from other people and not to go outside the house unless there is an urgent need. Use a mask when on the move in public place or crowd. Wash your hand regularly with soap and water or hand sanitizer containing at least 60% alcohol after doing activity outside the home or in the public place. Increase adherence with a healthy lifestyle. Do not touch the eye, mouth, and nose before washing hands. Avoid contact with sufferers or people suspect of having COVID-19. Wash your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash. Avoid being close to people who are sick with a fever, cough, or runny nose. Keep clean objects that are often touched and environmental cleanliness. For people suspect of being affected by COVID-19 or influence in the ODP, monitor person, or PDP, patient under surveillance category, there are steps that can be taken so that the coronavirus is not transmitted to others. Namely, do not leave the house except for treatment. If you want to go to the hospital when the symptoms get worse, you should first contact the hospital to pick up. Do independent isolation by staying apart from others for a while. If it's not possible, use a bedroom and bathroom that is different from what others use. Prohibit and prevent others from visiting you until you are completely healed. As much as possible, do not have meeting with people who are sick. Avoid sharing the use of poultry and drinking equipment, toiletries, and sleeping equipment with others. Wear a mask and gloves when in a public place or with someone else. Use tissue to cover your mouth and nose when chewing or sneezing. Then immediately throw the tissue in the trash. Thank you.